and good to have you with us on this edition of the Urban Debate. Viewers, something very interesting and a little concerning is going on as far as India's war against COVID is concerned. Now, Miranow's team has done some exhaustive digging of numbers and collated some interesting statistics to figure out these trends that show a little bit of a concerning picture. As India prepares for the round 3 of unlocking from 1st of August and as India looks towards the next round of policy making, we need to keep in mind what's happening in our country right now. These are the statistics. This is the information that the policy makers will have to consider before they take any other kind of decision. And let me tell you what's happening. This is what our own data analysis has shown. We'll also have experts who will join us to share their views on some of these key trends. Firstly, what we have seen is that the COVID cases now being reported from the interiors of our country outside the big metros are on the rise. From states who had so far managed to keep a very low number, from districts that had barely reported any cases, are now reporting a high number of cases on a daily basis. Let me give you just one example. The state of Andhra Pradesh. In the state of Andhra Pradesh, the cases being reported in just the last 1 week, from July 20th, when the cases stood at about 53,724, to then 64,700 by July 22nd, to 80,858 by July 24th, to almost now hitting 96,300 cases as of yesterday, hitting the 1 lakh number very quickly. Look at that surge that is emerging from Andhra Pradesh. Andhra Pradesh is not the only example. Tonight, our data will bring you the reality of what's happening in Karnataka, which has surpassed Tamil Nadu as the second worst hit state after Maharashtra. We will bring you the reality from Madhya Pradesh. There are some shocking insights coming in from Bihar, that a state which has been hit by floods in 11 different districts is also now grappling with the COVID scenario, and the literal absence of healthcare infrastructure is only worsening the status there. We'll also get you the details from Jammu and Kashmir. Again, a state that doesn't get spoken about, a union territory that doesn't get spoken about much, but is struggling, and numbers really tell you the story there. Let me tell you some of the other trends that have emerged. Over 80% of the districts in Bihar, Karnataka, Andhra Pradesh have seen a surge in the past 1 month. Now remember, we are talking about from June to July, a 1 month period which has been largely where you would see the impact of the real unlocking. The doubling time has nearly halved for Andhra Pradesh, Bihar, Madhya Pradesh in just the past 1 month. When I say doubling time has halved, that means it's now taking our lesser time to double the number of our cases. That's not good news. The increase in positivity rate is also something that the experts are closely tracking. Now, it could be because you've increased your testing in areas with high number of cases, but it could also then reflect the kind of spread we've already seen in Bihar and Andhra Pradesh and West Bengal and Karnataka. Also, Andhra Pradesh, Karnataka, Bihar have added over 80,000 cases just in the last 1 week. So while the initial attention and the concerns were cities and states like Delhi and cities like Mumbai, they are now showing an improvement, but it's the other areas that have become a bit of a concern. So let's gradually over the next 45 minutes, let's get you all this data. State by state, I will give you some insights. We also have experts who are joining us from various places. So let's say good evening to Dr. Anant Bhan, researcher, global health, bioethics and health policy. Dr. Manisha Priyam joining us this evening. Dhanya Rajendran, editor of the News Minute. Dr. Abel Lawrence, professor clinical immunology and rheumatology with SGPGIMs in Lucknow, a very renowned hospital. Dr. Girdhar Babu, professor and head for life course epidemiology at the Indian Institute of Public Health in Bengaluru. Good evening to all of you and thank you for joining us. I actually want to start off with what's happening in Andhra Pradesh and in Karnataka. These two seem to be, suddenly become a big challenge. And what we're also seeing is that on ground, as the cases rise, the authorities have been caught unaware. It's as if they didn't think this was a possibility post unlocking, and now the medical infrastructure and the health infrastructure is struggling. Let me begin with Dhanya to get an overall insight into what's happening in the southern states, Dhanya, especially Andhra, even Telangana and Karnataka.
Well, as you said, the numbers have been increasing quite rapidly in Karnataka and Andhra Pradesh. Even in a state like Kerala, now for the last 1 week, we're steadily seeing around 1,000 positive cases, and these are restricted to certain areas. For example, in Kerala, it's mainly in Thiruvananthapuram. In Andhra Pradesh, while it was Kurnool for many days, now it's shifted to East Godavari. In Karnataka, of course, most of the cases are from Bengaluru, but we are seeing in Karnataka and Tamil Nadu, for example, we are seeing now cases steadily increasing across districts. Now, the problem for a state like Karnataka is that most of its health resources, including hospitals, are based out of Bengaluru. And even the government's attention seems to be on the capital city. So, if they do not really increase their capacity in the districts, then it is going to be problematic if cases increase in districts. Like mostly in northern Karnataka, where we are seeing cases every day, even in coastal Karnataka, it is imperative that the government now increases the number of beds, oxygen beds, ICUs, ventilators, etc. Or in the next 2 or 3 weeks, if the cases really increase, and the government is going to find it very difficult. In Andhra Pradesh, we are seeing that patients are being moved from one district to the other simply because there are not enough hospitals across all districts. So that is going to be a problem which all the states will face, I think, except perhaps Tamil Nadu and Kerala to a large extent, if the cases spike.
Okay, let me also actually bring in Professor Dr. Girdhar Babu on this conversation. Dr. Girdhar Babu, while the government says largely the spike in cases in Karnataka has been because of the travel that took place, and possibly so, do you agree that maybe the healthcare infrastructure part isn't prepared to handle this, especially outside the key cities?
Yeah, so the surge in cases, although began with the import of cases from elsewhere, there has been local circulation going on both in the states of Karnataka and Andhra Pradesh. And medical infrastructure, although it's ready, I don't think any city is ever ready for the kind of surge in cases that we see. So therefore, prioritizing beds for only those who deserve, especially for those with severe ailments, is the need of hour. What we also see is that most people, out of panic, want to take the beds either because they think that they might need these ventilators or oxygenated beds in future, or just they want to play safe. And this is the major worry for distribution of beds in a real-time basis. I think there has to be a lot of focus on destigmatizing and also making sure that the fear is taken away from mild cases and also asymptomatics. Then I think we have enough oxygenated beds in Bangalore. The beds with ventilator in ICU seems to be a problem in most cities in India. However, in the experience so far, not many people require ventilator. If you have high flow oxygen, if we are able to cater to those people, I think we should be fairly well. So I think we should also remind ourselves both Karnataka and Andhra Pradesh in particular, have lower death per million and also lower case fatality rate. Although the surge in cases is real and it is here to stay, it's a good thing that the mortality rate is not really surging. And therefore, that means that the health infrastructure so far has been come. There are problems. I'm not denying that there are no problems. However, so far, both the states have done well.
Dr.
So, to your mind, what is really leading to this surge in cases, Dr. Girdhar Babu? Why are we seeing this, especially in states of Karnataka and Andhra Pradesh?
So I think we need to face this for all the metros and also tier 2 and tier 3 cities. There's no vaccine available, and a vast majority of the people are still susceptible for the infection. So with the unlock versions 1 and version 2, there is going to be increased movement. So we simply cannot escape from local circulation establishing in places where there is dense population. So that's for real, number one. Number two, are we ready if there is a surge in cases? So what is playing out, what initially played out in Mumbai and Delhi, later on followed in Bangalore. So next will be tier 2 and tier 3 cities, which are already surging, like the cities of Belgaum. So therefore, how do we actually plan a real action plan, as Ms. Danya rightly pointed out, in terms of how do we manage in the district headquarters and how do we manage in other towns? For that, health department has already made provision for oxygenated beds in community health centers in the state of Karnataka. And I don't see there is a major problem for oxygenated beds. Problem is still, as I said before, for the beds with ventilator. And I sincerely hope that not many people would require, based on the evidence so far in India.
Okay. No, in fact, Danya, you wanted to ask a question. Go ahead, please.
Yeah. So, Dr. Giridhar Babu, yesterday you had also tweeted, I noticed 2 days ago, in fact, the BBMP also had put out an appeal saying that those who have mild symptoms or those who are asymptomatic, please isolate at home or at the CCC, do not go to a hospital. So, also as a lay person, I want to ask you, we are also hearing a lot about people sort of dying at homes because they stay back and their oxygen levels become really low. And they do not realize it, right? So if someone has mild symptoms, but still they have comorbidities, you still think they have to go to the hospital and not stay at home. When you say mild symptoms, what do you actually mean?
The guidelines are very clear, Ms. Danya. And also, when you say many people are dying at home, that's not true. There are few cases where with comorbidity, they have
No, I
not
didn't mean
been
lot, many people, I mean
actually
of people who
forthcoming
die.
to get admitted in the COVID care center. So let me complete the answer. So what's happening is the guidelines clearly say that the medical team will have to assess and then make sure that they're given the kits which contain pulse oximeter and thermometer. Only if the person is eligible and the house is eligible, then home isolation is allowed. If the home isolation is not possible because they are not eligible, then they're advised and immediately shifted to COVID care center. This is the protocol. And for any person with comorbidity, whether it is mild or asymptomatic, they are shifted to DCHC, which has oxygenated beds. And if somebody is elderly, also is shifted right away. So there's no option for people with comorbidity or elderly to be allowed to stay at home. So that's the guideline in the state of Karnataka.
Okay, that was my doubt.
I think essentially what also has to happen is it can't be left to the decision of people. They must. I mean, I believe they should seek medical advice, even if you don't have to land up at a hospital to do that and run from one hospital to the other. But what's happening to you and what should be the response should be left to the experts to assess. And of course, a large part that plays out there is then the stigma. People should not, hide or stay indoors for the fear of the stigmatization that really happens. And for that reason, then not come forward. Now, very quickly, Danya, for Telangana and Andhra Pradesh, actually, the government moved very quickly in the initial days in terms of bringing in the testing kits, screening and setting down policies. What have your own reporters found? Why is it that this state is suddenly showing this kind of a surge on ground?
Well, on the ground, there are two things which the administrations in various districts are telling us. One is that the cases surged primarily because travelers from across have come back to Andhra Pradesh, which is the same in Karnataka or any other state. But there's also been a lot of movement within districts in Andhra Pradesh because people tend to go to Telangana to work, or they also go to other districts of Andhra Pradesh. So many of them came back, and the sort of contact tracing and also keeping track of who's come back, that's not happened very actively. But I think, as Dr. Giridhar pointed out, Andhra Pradesh has been quite successful in keeping the fatality rates down. And till now, in fact, we have not heard too many complaints, even from people who have been hospitalized in Andhra. We keep getting those stories from Telangana about dissatisfied patients, about what's happening inside the hospitals. But Andhra seems to have managed. And remember, Andhra does not have a local administration system. The elections have not happened. So they are managing the entire thing with a volunteer system. And they seem to have done considerably better when compared to Telangana.
Just to let our viewers know that the Andhra Pradesh's the doubling time for cases as of June 25th was 13 days. It was taking 13 days for the cases to double. that doubling time as of July 25th, just 2 days ago, had reduced to almost half, to 7 days. And keep in mind that now you're looking at a larger number of cases as well. So if that is getting doubled, within 7 days, that obviously shows that a lot more cases are being reported. The infection has spread. Of course, as long as the healthcare infrastructure is able to handle it, it's all right. Just a word of caution, I'm not saying any specific government may be intentionally doing it, but I tend to take the fatality rate and the mortality rate with a pinch of salt, because in the past we've seen several governments and administrations have actually revised their data, admitted there has been something wrong with the data, with the way it was being collated or updated and what was being counted as a death due to COVID or not. But what is definitely, a larger trend is the rate of infection which is happening in these states, the R0, which often gets quoted by the experts as well. Now, while this is one part of it, let's also talk about some of the other states which are showing a concern. And Manisha Priyam is with us. Manisha Priyam, the one big concern is, of course, the state of Bihar. Now, it's a well accepted knowledge that Bihar has the worst kind of healthcare infrastructure. It ranks second from the last in the healthcare index for the entire country. But even with that, despite that, what preparations have they done? It doesn't seem it's enough at all, because now as numbers jump across the state, they are literally struggling, and stories of horrors are emerging actually literally from every district of Bihar. What is it that you've been picking up?
So today, as we speak, just an hour before the show's rolled, I have been sent a message saying that the disaster management, principal secretary for disaster management has now been made the secretary for health. So in the corona times, I would say that twice over, this change has happened. So whatever pre-planning was required, you got the gentleman doing the disaster management, now coming and doing health. So it seems Bihar has just got a handful of people who can manage the situation on the ground. And IAS officer Pratyay Amrit is a very competent and able officer. But health is something that's new. So let's see how he does it. Now, I think the real issue that's going to be of challenge in Bihar is as follows. And this is really significantly different from that in Karnataka. The primary healthcare center does not exist in Bihar. Literally, it's a collapsed situation. In Gandaman, in the 2013 midday meal tragedy time, I was on Times Now, and I said the children died not as much because of poisoning on school, because after the poison, there was no primary health care center to go to. So most members of parliament, for example, Saran, the constituency that I come from, Mr. Rajiv Pratap Rudy runs an ambulance service. You've got a call center. Now, all of these are very effective. But imagine if for COVID, you have to be picked up by a call center and taken to 100 kilometers away to Patna. That's going to be very difficult. So the lack of local infrastructure, something that the Nitish Kumar government should have handled. He's been in power now from 2005. That change has dramatically not happened. You've seen the situation of the hospitals during the time of the Chamki Bukhar, the encephalitis that struck Muzaffarpur. In the Gandaman tragedy, then I had raised this issue that, look, the children have died, but you didn't have a primary healthcare center. This time around, we have understood with national experience that the handling of COVID can be done very well. The more you localize the patient, the more you say, if you fall sick at home, first stay at home, don't go around spread it. But if we have to say, if you fall sick, first thing we have to do is to transport you, that's going to be very difficult. And let me tell you, in Bihar, the first spread happened because a patient was being brought in by an ambulance from, I think Munger, or I don't remember the district, but he was being brought in. Ambulance driver was infected, the attendant was infected, the hospital that he came to, they got infected. So I think the challenge is really going to be, how does Bihar set up those millions of beds in many different locations? Now, this is something they should have done already. Remember,
yes,
we are dealing with a crisis situation from March 22nd onwards. Now, March 22nd, we are now on July 27th. How many months is that? This was the advance and lead time. Tell me the 10,000 bed hospital that has been made in Bihar. Many districts in Bihar, for example, are 18 hours away from Patna. What are the big hospitals there? What's the plan? And I think now Chief Minister Nitish Kumar will have to come out and do confidence building. His normal style these days is, for a while I've seen, he doesn't like to come out. He doesn't like to come out. He doesn't like to make any statements. He just stays away. Now, I think confidence building is very, very important. You've seen during the Corona times, whether people like it or not, but the PIB was addressed by senior officials of the Health Ministry, of the Home Ministry, by the ICMR. We can have our differences of opinion, but everybody remembers who the ICMR chief is. We realize that we had some setup. Whether we like it or not, the Home Minister of India went to the LNJP hospital. Public pressure was built that the Home Minister should go there. Many people believe today that yes, the Delhi government turned around, but the center had a contribution to make. It wasn't as if only one party was making it. Now, these are very different states. The North Indian state of Bihar is very poor and deficient in terms of local institutions. The panchayats in Kerala, for example, we were in a webinar dealing with labor issues this afternoon. Panchayats have done very well in Kerala. In Bihar, panchayat bhavans may have been used, mukhias may have done something, but the local people institutionalism is really missing to that extent. So you don't have primary health care centers, you don't have local good hospitals.
Yes, in fact, if I can just add,
able to build special hospitals. So how it is going to be done now is a plan that needs to be publicly shared immediately. Bihar has had enough time to do all these things.
Yes, and like you rightly said, Manisha, Priyam, like you rightly said, they should have done it by now. What the 3 months to 4 months that they have wasted, what were they doing all this while? Even now as we speak, it's just AIIMS Patna that's recently added a 4th dedicated COVID hospital. The entire state, viewers, has only 4 dedicated COVID hospitals for a population that runs into crores. One hospital in Patna was catering to 22 districts. Now, of course, individual hospitals may have some of the other kind of a COVID ward, but it's not enough at all. And the cases are rising. If you see the spike just in the last 1 week, and this spike is despite the fact that the testing levels are abysmal and are very low in Bihar even now. There isn't enough testing going on. Now, let me also bring in an expert on why are we seeing this and what's really happening. And Dr. Abel Lawrence is joining me. Dr. Lawrence, for the jump that we are seeing not just in Bihar, but in Madhya Pradesh, even in parts of Uttar Pradesh, could we now say that this is also because of the travel, because of the migrants who've gone back? And as we were then, saying that could lead in a spike in cases, that's what is happening right now. How else do we explain the spread in the interiors?
Low-level community transmission has been happening for quite some time, and lack of recognition of this fact has led to insufficient measures to reduce community transmission. And the number of cases introduced, whether through migrants or travelers coming from abroad, that only determines the timing of the peak. Places which have more migrants coming, more people coming from abroad, they will have peaks earlier. Places which are far away from civilization, far away from international travel routes, like the interiors of Bihar, they will peak later. So this only affects the timing of the peak. Everywhere where once it enters, it will surge. So we should have been preparing for community transmission by educating people. What we have been seeing is once the lockdown was ceased, people were going back to conducting marriages where, when you say 50 people, but 100, 200 people will attend. And all the social distancing have been more of like, nominal. They do something, but the spirit of social distancing has not been followed. Social distancing has 2 components. One is physical distancing, keeping a particular certain 6 feet, 2 meter distance from each other. The second part of social distancing is meet fewer number of people. If you meet large number of people, even if your individual risk for each encounter is small, your ultimate risk is higher. So the way to reduce effective reproductive rate is to reduce the number of unnecessary contacts from people. And all those who have to contact people, they have to wear useful masks. And if you see even our politicians, our leaders, prominent people, they have been cheating on masks. People wear masks below their chin, they don't cover their nose. So we have to educate people on how to use masks, when to use masks, and to avoid unnecessary contact. If we have been focusing on reducing community transmission, we could have avoided this surge. Countries in the European Union have shown that just by social distancing and use of masks, you can actually effectively reduce transmission. And third thing is testing. When you test people, what you do is those who are identified as having COVID, they are removed from the pool of people who are spreading. So extensive testing actually reduces transmission. And this is very effective. So when you test, you don't have to test, you should test more than symptomatic people. If you have diagnosed somebody as having COVID, you have to test their contacts. So contact tracing and social distancing are sufficient to stop this pandemic. It seems that many people are resigned that this surge is going to happen. Nothing is inevitable. Nothing is fixed in stone. If we do a concerted effort, reducing social contacts, postponing marriages, you go and meet somebody only if it is essential. Increase testing so that all contacts can be traced and tested. We can reduce transmission. So this concentrating on reducing transmission should be done hand in hand with the healthcare infrastructure. Just concentrating on treating people will not stop this problem because this will become very huge.
Yes, no, I absolutely agree with you. But, I have a feeling that there are more and more instances and trends now emerging from various parts of the country that we seem to swing between the two sides. People and the governments and the administration, both segments. Either we are ultra careful, we don't want to step out, we don't want to, interact or take any risk. Or when we do, we completely forget about the norms, don't follow any social distancing, completely forget the sanitization norms. And the governments themselves too. Either they let you be, unlock and forget about the basic implementation. There's absolutely no crackdown happening on ground where there are violations, or then suddenly they realize, oh, the cases have spiked. Let's just go ahead and lock down again. Let's do a twice in a week lockdown. Let's do a 10-day long lockdown. Whatever they think gives the perception that they are aware of the situation and they're taking action. Dr. Anant Bhan, are we getting this policy wrong? The response to a spike in cases doesn't necessarily have to be a lockdown, but what should it be going forward?
So I think many of the panelists already alluded to it. I mean, as you are rightly pointing out, part of our challenge now is that, the response is pretty much driven by what the data on that day is. And we're now seeing a season of lockdowns returning. And some of these lockdowns don't make any sense. They started off with this approach of a 12-hour lockdown, then it became a Sunday lockdown, then it became a 55-hour lockdown. Then some cities decided, no, 3 days is better. Some cities have gone ahead for 10 days, some states, so there is so much variation within this approach that there is absolute no clarity as to what criteria are being used for deciding that you want to go in for this intermittent lockdown approach. The intermittent lockdown approach can only have any utility when you actually link it with concerted public health efforts in ramping up your response, whether those be ensuring your health system preparedness is going up, your testing rates are going up, you're ensuring that you have a system in place where you're engaging communities to try to get adherence on public health measures like usage of masks, like ensuring physical distancing. But you don't see that. I mean, what we see is still there are violations happening even during lockdown. Sometimes the politicians themselves are responsible. There was this funny incident where the Home Minister of Madhya Pradesh, when he announced the 10-day lockdown in the capital city, was not using a mask. He had 12 people around him, all of them not using masks and in very close proximity to him. So it was sort of a joke that, here you are announcing a lockdown because there is a spike in the number of cases. And what are you showing in terms of, the time that you're announcing it? That there's absolutely, and, we unfortunately in MP have the only chief minister who himself is now down with COVID-19. So, I mean, it sort of shows the fact that, the role modeling, which is what one would expect from the leadership of the state, is somewhat lacking. The other thing is, I think, MP interestingly came out with this large campaign called Kill Corona, which they launched on the 1st of July. At that time, we had around 13,500 cases. By the end of that campaign on the 15th of July, we had 19,500 cases, and now we have around 28,000 cases with around 800 deaths. So it's also unclear, with what aims or objectives did you launch that campaign? Did you actually manage to achieve them or not? And what were the learning? Because, if anything, it would seem that that campaign really did not succeed. So, you maybe need to go back to the drawing board. But the drawing board, whenever they go back to, it ends up becoming typically a curfew response or a lockdown response, which is about, putting up, police pickets in the city, preventing people from going out, beating them up, imposing cases on them, but not really talking about how you can get communities to get involved. So as some of the fellow panelists were saying, unless you go down the way where Kerala has gone and gotten communities to take ownership of these decisions and say that communities are the ones who have to impose measures which can help in adherence, or go the Northeast India way, where local church groups, local youth groups, local community heads have been involved to try to get local communities to adhere. Otherwise, you will always have violations, and violations are fertile ground for the spread of the infection. I mean, I think we have all realized over the last few months that lockdowns are not going to be any kind of a panacea for COVID-19 response. They might be useful as a temporary platform to allow you to do some preparation. But if you think in some magical way lockdowns will help you avert the spread of infection, it's not going to happen. It's now pretty much almost a statewide and a nationwide spread.
Yeah.
And we have to, the sooner we realize that, the better it will be. We cannot keep going into lockdown mode. It's not going to help beyond a particular, smaller acute phase.
Yeah, I mean, very interestingly, Dr. Bhan, it was recently, I think, the Chief Minister of Haryana who actually made this point that anybody who's resorting to these kind of return of lockdown tactics is merely doing it for perception, because nothing less than a 15-day lockdown will even show you any impact at all. And I tend to agree with him, but the people in some states and governments are just taking it as the easy way out to show that they're doing some work. Now look at Madhya Pradesh. Here, the implementation of the lockdown is completely upside down. So your leaders are holding all kinds of events and ceremonies and celebration and oath taking and cabinet expansion, and every single of these events have actually been a glaring example of social distancing violations. And this is despite the fact that just in the beginning itself, the health minister and several others had been infected with COVID. Now it's the chief minister who's been infected with COVID, but they don't seem to change that. On the other hand, it's so easy for the Madhya Pradesh police, and repeatedly it's these stories emerge where they are harassing those sellers on the road, turning the carts, vegetable carts upside down, as if that's the only way to implement a lockdown in your state. A completely, chaotic, misguided policy and implementation plan. And that, I think, is one of the bigger concerns. But Manisha, Priyam, if I can just quickly come back to you, especially on, states like UP and Bihar, where healthcare infrastructure is so bad any which ways. What is it that the governments need to do immediately, what they aren't doing before they actually resort to more lockdown kind of policies?
See, lockdown is a power over people. And why in a state which has had a strict lockdown in March, should you go back to a strict lockdown again? Can somebody tell me? Lockdown is simply meant to extend the time period for the infection. Lockdown does not stop the infection, but it buys you time to ramp up the infrastructure to deal with the disease. It's human being and the disease at war. The state is a care mechanism. The state is an institution building mechanism. The people of Bihar happen to be the poorest in the world, by the way. The poorest in the world. Do you know of the numbers that have walked back? The estimates of people who have gone back. The All India figures are of 30 million people of experts shared with me by the Tata Trust people, verticals that work on labor migrants, of which a major proportion is Bihar. I have written in an important national daily that these laborers who've gone back to Bihar, they also suffer there because their land holdings are very small. So therefore, between UP and Bihar also, it's a Bihar-focused situation. You have the poorest of the world who have walked back the longest distances, whose only source of earning was being in the city. They have no means to be able to save themselves except the state. And what was the state doing from March, April, May, June, July? Right? Now, 5 months, you need a lockdown again. Isn't Haryana Chief Minister then telling you what is actually the case? hammer and tongs, this state government should have taken the help. Remember, Nitish Kumar is a good governance Susashan Babu. He's been helped by the World Bank. The world has celebrated his good governance model. All those policy experts, once upon a time, when he had very good relationships with the UPA in the center, Amartya Sen was his advisor, right? You had Nobel laureates advising him. You also have local centers like the Adri coming out and saying very good governance is going on. So can you tell us what the crisis response mechanism was like? Crisis response is not just distributing ration and cash to people when floods arrive. It is also about building institutions. Now, on a positive note, Nitish Kumar did a lot for education in Bihar in the earlier parts. It surprises me that health is something that has never got the attention that it should have. And remember, even today, the fact that under the rule of Mr. Lalu Prasad Yadav, hospitals came to be in a bad shape, doctors were abducted, it was called Agwa Raj, and there was Jungle Raj and whatever else was mainly about abduction of doctors, private clinics, etc. It surprises me that despite making a lot of progress on roads, electricity, education, all of these good governance signs, this area remained weak. And even in the face of a pandemic in the last 5 months, the people of Bihar have been shouting crisis, even before the lockdown, even before the spread. Now, the latest that I hear is anybody I talk to, and especially if they happen to be powerful people, they want to blame it on the poor, saying, "Arey, यहाँ का गरीब तो गमछा भी नहीं बांधता है, ऐसे ही घूमता है. So poor are the spreader of diseases." No, they are not. They have no means, not even for a square meal. People who have walked back thousands of kilometers haven't done it to spread disease. They went back in the month of March and April. If this disease is spreading today, it's not because of the poor, but because of the inability to explain the social mannerisms of fooling a virus by avoiding social contact, by fooling a virus by isolating you in your homes, by building the trust with people and saying, आपको कुछ नहीं होगा, आप डरिए मत, आपको हम घर पे भी रख के ऑक्सीमीटर देंगे. Now, the state in its avatar of state of care, state of, ethic of care, for example, building up various relationships. If that state does not exist with its social arm and does only competitive politics, electioneering, then you will face these challenges. Now, who will bear the cost? The poorest of the world will bear the cost.
Yes, absolutely. In fact, Manisha, Priyam, I'm sure...
Tanvi, let me conclude.
I'm sure you're well aware of a lot of these instances.
Dead people, hungry people cannot rise up and speak for themselves. We need to rise up and speak for them. So I thank Mirror now for raising this issue today. Go ahead. Sorry for taking the time.
I completely agree with you, and it's always the voice of the poor that doesn't get heard. Nobody is going to raise these issues, but they should be, and they should be addressed. And Bihar had more than enough time to prepare, at least have basic facilities in place, basic campaigns and awareness programs in place. More and more reports that are emerging from various districts, and I'm sure Manisha, Priyam will agree, are about missing governance, missing officials, missing administration, or the administration and the hospital staff themselves being infected and quarantined, and that's what's even adding to the chaos there. Very quickly, if I can go back to our experts, for this larger perspective that I was seeking, and maybe Dr. Girdhar Babu, we can start with you. The fact that now we have enough evidence to suggest that the infection has spread to the interiors. What should be the priority for any government? Now, in cities, it was perhaps still easier to prepare your healthcare infrastructure for surveillance, screening, isolation, even forcing people to go follow the norms. Once it spreads to the smaller places, smaller towns, then what should be an administration's priority?
Yeah, so I think we need to look at only from an evidence point of view. So far, 80% of the cases have occurred from 20% of the people in crowd and closed space settings. And therefore, this is going to be the driver. The cities, whether it's tier 2, tier 3, will have the maximum number of cases. In order to contain, what we should be doing is, when you have large number of cases, you can't be doing individual case-based contact tracing. You need to do repeated ILI, influenza-like illness surveys in the community, identify all those who have COVID-19-like symptoms, test them. I agree with the other panelists. When you test more, you will be isolating them more. You'll be segregating those who require treatment at the hospital and those whom you can segregate at the other COVID care centers. And also, what you're doing is you're interrupting the transmission from spreading around. So when you isolate people, they are spread it to more number of people. So repeated ILI surveys is going to be the first step. Testing in those who are symptomatic is the next step. Third, identifying those who require hospital, especially with oxygenated beds, and then admitting them well in time will reduce the deaths and it will save many lives. And this should be the strategy everywhere. I agree with the other panelists, but many problems are there. We can't be looking at overhauling any systemic issues right now, but we should start strengthening primary health care everywhere, not just Bihar. Bihar is absolutely the top priority, but all urban areas in India, including the metros, do not have primary healthcare system robust enough. So we should be starting investing in urban primary healthcare and in the areas such as Bihar on top priority, and that will save many lives. I agree with that view. Thank you.
Okay, very quickly, Danya, do you want to come in on this aspect as well about the policies that some of these states, whether they're even considering, new fresh steps to ensure that they're able to fight this back properly, apart from saying, okay, now we will restrict travel or now we will implement lockdown of some kind?
No, I think most of the states, to be fair, I mean, I cover only the 5 southern states. And to be fair, I think they do come with policies. They keep changing their SOPs almost every week, whether it's about testing, it's about pricing. There's definitely a lot more to do. Then this is the first time that any of us, including our health system, is facing something like this. So as far as I think changing their SOPs go, I think most of the states have been doing quite well, except of course Telangana, where we don't know half the time what is happening. And I think that's another important thing, transparency. Those governments that are not transparent, this is the time to really start, because there's no other way that you are empowering your people. You have to give them the knowledge and tell them what is happening around them. Otherwise, people are also going to take it very easily. If you're going to hide the numbers, then people around you are going to take it very easily, and that's going to be a headache on your healthcare system.
Yeah, actually, that's a very interesting point. Dr. Bhan, would you want to comment on this? The fact that we even know that a lot of states have perhaps intentionally not ramped up their testing because the numbers won't look good for them. And so far, they've tried to avoid ramping up testing. But until and unless we test and know the real situation, people will take it for granted. People will assume situation is fine. And we won't know what our correct policy should be.
Absolutely. Unless we test enough and we test widely, we will not really know the true burden of the pandemic. And that is in no one's interest, including the policymakers, because at some point of time, if you keep suppressing the data, it will, bounce back at some point of time, and you will know, and these kind of things cannot be hidden beyond a period of time. So I think, it might be a short-term measure, but it can spectacularly backfire on the politicians. And I think it's just bad policy. Rather, you should be focusing on enhancing your testing and making it widely available so that it's not just concentrated in the cities. It's actually available as much as possible in rural towns and closer to rural centers as well. And, there are now many guidelines which are available. There have been sometimes, civil society groups have come out with guidelines around how communities should prepare, how community-based health facilities should prepare, how we should be looking at mental health implications in the communities. It's just a matter of just, ensuring that we are able to implement those guidelines. If you are smart as a policymaker, as a state, then you will look at a lot of this which has already been generated and try to apply it and prepare. Because, if we keep our urban-centric response just be the only focus in our states, then I think we are going to be neglecting a lot of the spread of infection in rural areas. And many large parts of India, including Madhya Pradesh, Bihar, Rajasthan, Uttar Pradesh, are largely rural states. And, we don't really know how this disease is spreading. The hunch is that, it is an increasing spread and it is now catching pace. So the only way we can prevent any worst case scenario is actually putting in our prevention measures and ensuring we have a good sense of where the problem is, where the surge is happening and trying to respond in those areas. But we cannot do that unless we have good quality testing happening. So, I mean, at the least, we should be doing what we should be doing is ensuring that there's adequate testing happening.
Yes, absolutely. I think that needs to be a priority for the entire country. And thank you so much to all of our panelists who've joined us in this conversation. Mirana will continue to dig out the data and bring you such trends and analysis that need to be even in the radar of our governments and policy makers, so that they are able to actually formulate a better policy. I'm just very quickly going to give you some interesting insights again and reiterate why this is important, because viewers, last week 30 of the 33 districts in Telangana saw new cases in COVID. 30 of the 33 districts of Telangana. That just goes on to show that it's pretty much spread across the state. 21 out of 30 districts in Karnataka reported over 1,000 cases of COVID. 42 out of 75 districts, even in Uttar Pradesh now, have reported over 500 cases. 31 out of 38 districts in Bihar have reported over 500 cases of COVID. This just goes on to show that it's now spread into the interiors. It's no more a problem of a few selective cities, even if these cities actually carry a larger load and a larger chunk of the cases. But if we are not careful, and if we don't implement our norms and don't have a proper healthcare infrastructure ready, then this could become a difficult problem. Thank you so much for joining us on this conversation.